Ever found yourself wondering what patients wish healthcare professionals would stop doing? Well, you're in the right place. Today we're delving into a topic that's seldom discussed yet incredibly important. We're lifting the veil on 15 things patients wish healthcare professionals would stop doing. This list has been carefully curated from feedback and surveys, offering a unique perspective, straight from the patients themselves. Intrigued? You should be. Stay tuned to find out what these 15 things are. Starting off at number 1 on our list, let's address the issue of not adequately listening to the patient's concerns. In the hustle and bustle of a busy healthcare setting, it's easy to get caught up in the pace. But remember, patients aren't just a set of symptoms or a diagnosis. They're individuals with unique experiences and concerns. Taking the time to genuinely listen not only builds trust, but also allows for a more accurate diagnosis and treatment plan. Moving on to number 2, we dive into the realm of medical speak. While it's second nature to healthcare professionals, it's often a foreign language to patients. Imagine being in a foreign country, trying to navigate the streets without understanding a word of the local language. That's how patients can feel when we overload them with medical jargon. So let's simplify our language and ensure that our patients understand their conditions and treatments. And thirdly, we come to the issue of respecting the patient's time. Time is a valuable commodity for everyone, and patients are no exception. Long waits and rescheduled appointments can lead to frustration, and in the worst-case scenario, non-compliance with treatment plans. As healthcare professionals, we need to value our patients' time as much as we do our own. These first 3 points highlight the importance of effective communication and respect in patient care. Remember, at the heart of healthcare is the relationship between the patient and the healthcare provider. And like any relationship, this one thrives on listening, understanding, and respect. So let's strive to make these integral parts of our daily practice, shall we? Continuing on to our 4th point, let's delve into a common concern that many patients express. This revolves around the need for a more comprehensive explanation of treatment options. It's no secret that the world of medicine can be complex and daunting for those not immersed in it daily. Therefore, when a patient is diagnosed with a condition, they rely heavily on their healthcare provider to guide them through the maze of potential treatments. Yet, too often, patients feel that the options are not explained thoroughly. They are left with a list of medical jargon, rather than a clear understanding of the pros and cons of each choice. It's crucial that healthcare providers take the time to ensure their patients fully comprehend their treatment options. The 5th point on our list is the dismissal of a patient's symptoms. Patients know their bodies better than anyone else. When they express concern about a new symptom or a change in their condition, it's essential to take these observations seriously. Dismissing a patient's symptoms not only undermines their trust in their healthcare provider, but also risks overlooking critical diagnostic information. Remember, a symptom that may seem insignificant to a healthcare professional could be a vital piece of the puzzle for a patient's diagnosis. Lastly, for our 6th point, it's about acknowledging a patient's pain. Pain is subjective and personal. What might be a minor discomfort for one person could be excruciating for another. It's not uncommon for patients to feel their pain is not taken seriously enough. In such cases, patients can feel unheard, dismissed, and even disrespected. As healthcare professionals, it's imperative to validate a patient's pain and to provide appropriate management strategies. As we can see, patients value being involved in their care and having their concerns validated. It's not just about the physical treatment of a disease or a condition, but also the emotional and psychological support that a healthcare provider can and should offer. Stay tuned as we continue to explore more things that patients wish healthcare professionals would stop doing. Moving forward to our 7th point, we come across a critical component of patient interactions: emotional support. Patients are not just cases or numbers, they are individuals navigating a potentially difficult period in their lives. It's not enough to merely tend to their physical ailments, their emotional well-being is just as crucial. A comforting word, a reassuring pat on the shoulder, or simply taking a moment to genuinely ask how they are feeling can make a world of difference. Remember, as healthcare professionals, our mission is to heal, and that includes the heart and mind, not just the body. Now, onto our 8th point, the matter of rushing through appointments. We understand that healthcare professionals lead incredibly busy lives, with a multitude of responsibilities, and a constant influx of patients. However, when a patient feels rushed, it can lead to a sense of not being heard or understood. This can not only be detrimental to their mental well-being, but it can also affect the quality of care they receive. So, take a deep breath, slow down, and give each patient the time they need. Each moment spent attentively can be an investment in their overall health and well-being. Finally, our 9th point brings us to the importance of keeping the patient informed about their care. A lack of understanding about their condition or treatment can lead to fear and anxiety for patients. Keep them in the loop, explain procedures, discuss treatment options, and answer their questions in a language they understand. Demystify the medical jargon. It's not about dumbing it down, but rather, making health information accessible and comprehensible. These points emphasize the importance of empathy, patience, and transparency in patient care. The relationship between a healthcare professional and a patient is not merely transactional, it's a partnership based on trust. By incorporating these aspects into your practice, you can help foster that trust and contribute to a better, more inclusive healthcare experience for all. Next up, at number 10, we delve into a topic of utmost importance yet often overlooked: respecting a patient's privacy. It's easy to forget that each patient is a person, with their own boundaries and comfort zones. Medical professionals sometimes unintentionally cross these boundaries in their quest to provide care. Whether it's discussing sensitive health issues within earshot of others, or not adequately securing personal health information, these actions can inadvertently breach a patient's privacy. It's crucial to always remember to treat patients with the same respect and discretion you'd want for yourself or your loved ones. Moving on to number 11, let's talk about making assumptions about a patient's health behaviors. It's a common pitfall to jump to conclusions based on a patient's appearance, age, or even their medical history. However, it's essential to keep an open mind. Patients can often surprise you, and their health behaviors might not fit the preconceived notions you might have. For instance, not every young person is necessarily fit, and not every older person is inactive. Making assumptions can lead to misdiagnoses and ineffective treatment plans. Therefore, it's always best to ask questions, listen to patients, and understand their unique situations before making any decisions. Finally, at number 12, we look at the importance of considering a patient's lifestyle and personal circumstances. A patient's health doesn't exist in a vacuum. It's influenced by a multitude of factors, including their work, family, stress levels, and even their hobbies. It's crucial to factor these in when discussing treatment options or lifestyle changes. A one-size-fits-all approach rarely works in healthcare. Tailoring treatments to fit into a patient's life, considering their unique circumstances, can lead to better compliance, improved outcomes, and a more positive healthcare experience overall. These points remind us that patients are individuals with unique needs and circumstances. Lastly, we have the final 3 points on our list. Point number 13 is about staying current. Patients wish healthcare professionals would consistently update their knowledge base. The world of medicine is constantly evolving, with new research and findings emerging almost daily. It's crucial for healthcare providers to stay informed and incorporate the latest research into their practice for the best patient care. The 14th point touches on the importance of care coordination. Patients often interact with multiple healthcare providers. They wish for better collaboration and communication among their care team. This can reduce redundancy, improve treatment outcomes, and enhance the patient experience. Finally, the 15th point emphasizes the value of building rapport. Patients wish for more than just a clinical interaction. They long for a relationship where they feel heard, understood, and cared for. This can significantly improve patient satisfaction and adherence to treatment plans. These last points underscore the importance of staying informed, working collaboratively, and building strong relationships with patients. To summarize, we've journeyed through 15 things that patients wish healthcare professionals would stop doing. These points, though sourced from patient feedback, serve as a wake-up call for us all in the healthcare industry to continuously improve patient care. From respecting personal boundaries to improving communication to showing empathy, each point underscores the importance of creating a positive patient experience. Remember, it's the small changes that can make a big difference in a patient's experience. Thank you for watching.